In recent years, international adoption has become a topic of interest in the United States. Many celebrities have chosen to adopt internationally, which has led to a focus of attention on international adoption. Last year alone saw over 7,000 international adoptions into the United States, which is a low number compared to some of the previous years. These types of adoptions have received a lot of compliments for saving children and giving them a better life. This sounds good, but is it really true? Can internationally adopted children really adjust to life in a different culture? And does the country of origin have any effect on that adjustment? Those were the questions I ran into throughout the semester. This made me want to find an answer and become my focus for a research proposal. I chose Korea and China as the country of origin because they are culturally similar, yet there are varying levels of American influence in both cultures. Both countries also have different methods when it comes to adoption. One of the first things I did when I began my research was to look up the adoption statistics for each country. In the past 14 years, 71,632 children have been adopted into the U.S. from China. Most of these children were female. Another interesting fact I noticed was that most of these children were adopted by the age of 4. Over the course of the semester, we have learned that the age of adoption has a lot to do with a child's ability to adjust, as a younger child usually has fewer traumas to overcome. In contrast, Korea had far fewer adoptions, with 19,370 children being adopted into the U.S. within the same 14-year window of time. Another difference was that most of these children were male. More importantly, most of the children adopted from Korea were adopted before the age of 2, which increases their chances of being adopted before trauma is sustained. In order to determine the effect of country of origin on adjustment, I have looked into previous studies dealing with the adjustment of children from each country. Studies involving the adjustment of internationally adopted children have found that Chinese children have some adjustment issues, even when they are placed in good homes. This could be due to the institutionalization of orphans in China. Studies have found that children that have been institutionalized have delays in social skills and display either avoidant or clinging behavior. Children from China have also shown a tendency to form rapid attachment to their adoptive parents. However, over time, the rate of attachment slows and is harder to maintain. Adjustment styles have been found to change, with clinging behaviors being exchanged for avoidant ones, and vice versa. One thing that became clear in this study is that it takes time for children's adjustment to stabilize. It is a difficult transition for even young children to go from little one-on-one care to a setting in which it is common. Internationally adopted children have a lot to overcome, such as cultural, ethnic, and lingual differences. As a result, many of these children form insecure attachments. As they age, they also have to face racial issues, both internally and socially. These factors create feelings of not fitting in. It is easy to see how all of these factors can contribute to mental breakdowns, which are often seen in children and adults who were adopted internationally. Out of all of the internationally adopted children, Korean adoptees were found to be the most resilient. In a study looking into mental breakdown of adoptees, Koreans had few instances of breakdowns. It is thought that this is a result of how Koreans deal with adoptions. Korean adoption agencies are well organized. They are also dedicated to finding a good home for their children. Perhaps the biggest contribution to resilience is that most Korean children are adopted before the age of 2, lessening the chances of trauma and complete readjustment that older children face. Another factor to consider when looking into international adoption is the environment and attitudes children are raised around. Research shows that children who grow up in a racially diverse neighborhood adjust better than those who are raised in non-racially diverse communities. As children grow, they face more racial teasing and separation. This is more true in non-diverse communities. As time goes on, parents notice less racial differences between themselves and their children. They simply see their child as American. This can make things complicated if the parent is less aware of the child's differences they become less aware of the child feeling different. In the case of international adoptees in comparison with domestic adoptees, international adoptees achieve more academically. However, this is thought to be related to the higher expectations placed on these children, especially those of Asian descent, due to the stereotype that Asians are smarter. This group also showed more psychosomatic illness, signifying psychological distress due to the pressure. These children also report feeling more distance between family members. All of these results, when compared to children adopted domestically, seem to indicate that domestic adoption is better for child adjustment. Due to the research here presented, I proposed a study that would compare the adjustment of children adopted domestically to those adopted internationally. I also wanted to find if the country of origin had an effect on child adjustment. My research led me to hypothesize that Korean children would adjust to life in the U.S. better because there is a stronger American influence in their culture and because the Korean adoption agencies focus on getting children into a home before the age of 2. I also hypothesized that children adopted domestically would adjust better because there are fewer difficulties such as racial identity and cultural differences to deal with. My participants would be 500 adoptees from Korea who were adopted into the U.S. between infancy and 4 years of age. These children would be between the ages of 12 and 16 at the time of the study. This group would consist of an equal number of males and females. The same criteria would be applied to 500 adoptees from China who were adopted into the U.S., and for adoptees from China and Korea who were adopted domestically. All participants would be given the severity of depression assessment, and those scoring higher than PHQ-9 would be eliminated. Those participants included in the study would then be given the social adjustment inventory for children and adolescents to assess adjustment. This interview would be given both to adoptees and their parents, and their assessments averaged to determine the true adjustment of the child. This adjustment looks at school functioning, spare time activities, peer relationships, and home adjustment. The results would then be compared using a MANOVA. The prior research leads me to believe that my hypothesis would be supported. There are so many children adopted internationally that it is important to understand how transracial adoption and the adoption process itself affects a child. We have learned this semester that the effects of adoption can be seen into adulthood. Therefore, it is important to determine if international adoption is truly beneficial to a child. It is also important to determine if the country of origin has an effect on the adjustment, so that the practices that lead to poor adjustment can be changed. Thank you for your attention and for all your support this semester.